Hello, everybody. Thank you for joining us today for this pre-recorded session. My name is Perez, and I will be presenting alongside my colleague, Dr. Harold Pollack, over a presentation to show you how to help low literacy health patients to navigate health insurance systems post the passage of the Affordable Care Act. A little bit about myself. I am currently an MS1 at the University of Texas Rio Grande Valley. Before enrolling into medical school, I was a program coordinator for the clinical health systems at Emory University School of Medicine for the Department of Infectious Disease. Before that, I was a Teach for America core member, so I'm a former high school educator. And I'll pass it over to my colleague Harold so he can tell you a little bit more about himself.
Hi, I'm Harold Pollack. I'm a professor at the University of Chicago's Crown Family School of Social Work Policy and Practice, and also a public health researcher at the University of Chicago. I guess I would say I'm a PhD 34 since I started my PhD 34 years ago, and it's great to be here with you today, Isaac.
Likewise, it's very exciting to have a platform to talk about these issues. So I think one of the things that we do want to start off this presentation with is about health literacy. So what is health literacy, right? So it's usually referred to as the capacity of an individual to obtain, process, and understand the basic health information needed to make appropriate health decisions. And it's very important to know that low health literacy has been linked to specific groups such as older adults, minority populations, people with low socioeconomic status, and especially people that are medically underserved. And something that we do notice is that this can definitely serve as a barrier for a lot of individuals and their families when they're trying to navigate a complex health system such as the one we have here in America. I'm not sure if, Harold, you would like to elaborate a little bit about that.
Yeah, we have a bewilderingly complex health system, and there's a number of things we have to do to make the system more accessible and accommodating and transparent to all patients. But also there's real opportunities to help patients who may have some low literacy challenges, some very practical ways that we can help patients navigate that system more effectively. And as a healthcare provider, you really have a twofold responsibility. One is to work on the systems that you're part of to make sure that they are truly accessible and humane to people and that we don't have literacy barriers. But secondly, to help educate patients in these health literacy areas to help them navigate that system more effectively.
Awesome. And we were talking about systems changes. So we actually saw a big change within the structure of the American healthcare system with the passage of the Affordable Care Act back in 2010. The whole name for the law is actually the Patient Protection and Affordable Care Act, and it is commonly known as, the ACA or Obamacare. It was passed under his administration, so it took his name. It was a big push for policy there. And one of the major things that this policy did is it established a health insurance marketplace to make it easier to find and enroll and compare different health insurance plans. It also included an individual mandate for having health insurance. So it actually required you to have that, and it could be pretty much checked upon when tax filing season came around. And it did present some provisions aimed to aid with patients in literacy, and we'll cover those in a second. So one of the things we do want to talk about is that health insurance marketplace. So something that was found is that one half of adults consider themselves to have inadequate health literacy, and this can definitely present barriers that will complicate the process of actually choosing and enrolling a health insurance plan. And Harold, can you elaborate a little bit about what are some of those common challenges that may arise if somebody has low health literacy when they're trying to find a health insurance plan that works for them?
So I think many of us are really good at our day jobs. You take someone who knows how to take your Ford Fusion and figure out, oh, it's the exhaust system. I've really got to work on this part, but I'm really not sure what the difference is between the deductible and a copayment. And I have to get on the health insurance marketplace and then enter a bunch of information. And there's sort of 7 different health plans that have different networks. And most of us, it's fairly bewildering. It combines important, boring, and complicated in a really challenging way for all of us. And then, of course, there's health literacy and understanding our own medical needs and our own care. We have systolic and diastolic blood pressure. What do those numbers mean? How do I find out if a doctor tells me something, or a nurse practitioner or the provider tells me something? I go to Google and I find whatever Dr. Google throws up. And many of us have access to health services or insurance products that if we had a higher level of facility in navigating them, we could actually get some real value that could improve our health. But we're not ready to do that at square one. And the ACA, although it did some great things to expand access to healthcare, it does require some literacy, both about healthcare and about health insurance system, to really make best use of it. I'll pass it back over to you.
Yeah, and I know you bring a really good point about health literacy, but I think we should also realize that people that have health literacy have other issues with literacy, whether that be reading, whether that even be technological literacy as well. So the health insurance marketplace is actually an online website you can find at healthcare.gov, and individuals with low health literacy at times may not have the capacity to actually log into the system. They might not be able to create an account on their own. So we do need to find ways to provide adequate assistance for them to be able to do that as well.
Yeah, and I think, by the way, that with our seniors, of course, that would be especially likely to happen. My mom is super literate in terms of reading the New York Times every day. She does not use the web, at all. And so there's just many people with English language challenges and so on. We're asking a lot of people to be able to go on this unfamiliar website and go. That's not realistic for a lot of the people in our lives, and certainly a lot of the patients that people are trying to serve.
Yeah, that is definitely the case. And to make things even more complicated, right, we have this individual mandate that actually ties into your taxes. And usually when we have conversations about taxes, a lot of alarm goes, right? You want to make sure that everything's right. You don't want to be in trouble with the IRS. So that adds some extra stress. So we can talk a little bit more about that individual mandates. So it's actually established as a requirement for U.S. citizens and legal residents to have health insurance. And the main provisions for this was to increase the amount of people that had insurance, right? Give them an extra, I don't want to say incentive per se, but it's a little more motivation to actually go out of their way to do that. And that included a tax penalty of up to $695 or 2.5% of the taxable income, whichever was greater, starting in 2016. So you did have about a 6-year period to adjust to that since the law was passed. There were some exemptions that could be made based on financial hardships, among other criteria. And one thing that really does arise from this is that a lot of people with low health literacy might not be aware of these exemptions, right? I used to do some tax services when I was an undergrad. As part of some volunteer work, we were trained to fill out W-2s for some for individuals, and a lot of the times when it came to doing the ACA part, the requirements that let you make sure that you do have your health insurance, they didn't know that they could be exempted from that. So they were very worried of, like, I have to pay this fee. I barely have enough money to pay my bills. I barely have enough money for groceries. I have children that have needs, and I had to pay a penalty on top of that. And I don't know where to find this money. So that added a lot of stress to them, where if they were a little more familiar, if they were a little more what we call health literacy, or in this case, policy literate, they'd be able to understand that they shouldn't be stressing over that because those exemptions could have been made. It is important to know that this was actually repealed back in 2019. But I think, Harold, you can definitely elaborate a little more of the impact that this had on the policy level of healthcare.
I think there's a number of things going on there. One is there's a fairly complex subsidy structure. Many people don't realize that they can get health insurance either free or at a highly subsidized price, but it's complicated. And one of the most important things that we can do for our low health literacy folks, or low health insurance literacy, policy literacy folks, is to say, here's some resources that you can go to. Here's a nonprofit. Say you're in an immigrant household. Here's a local nonprofit that can help you navigate this, can help you sign up, can help you understand what the practical issues are for people in your situation. And if you're in a state that's expanded Medicaid, if you are a low income person, very often, you can get Medicaid for free, and you can learn about that. And so part of it is educating people. Part of it is connecting people to nonprofits and others who can help them get connected, because it's as you point out, it's scary to think, oh my God, I'm being forced to buy insurance. It's going to be expensive for me. I don't know how I'm going to pay for that. And I may even or I'm going to face some sort of a penalty, and to just assuage people's anxieties and to say, no, actually, there are some ways we can help you navigate this that can be very helpful to you. And now, sometimes what people learn is, at my income level, I do have to, insurance. I'm disappointed that I can't get cheaper insurance or whatever. But there are resources out there to help you, and you don't have to approach this alone if you're having some literacy challenges. I'll pass it back over to you.
Of course, thank you. And the Affordable Care Act actually tried to address these issues with health literacy. There's actually some provisions, and we've detailed the sections there for you all to read. And these are just ways to show that the federal government is actually has a high priority for getting this issue addressed, especially since research shows that people live longer, they have less complications from their health outcomes. So we'll really dive into what came out of these policies. So one of the main things that came out of this was what they call the National Action Plan to Improve Health Literacy. This was actually released by the U.S. Department of Health and Human Services. And I think I'd like to take a moment here, and if Harold, you can if you can elaborate on how particular sections of policy, like we saw in the earlier slide, go into having these plans made at the national level.
I think that the people who crafted the ACA had a pretty good understanding that the ACA is designed to serve every American, and everyone who lives in, and also non-Americans who are here, who are eligible for the ACA for a variety of reasons, and that we have to have changes in our healthcare delivery system that serve everybody. There are people with developmental challenges who are going to need some assistance. There's people with linguistic challenges. Things have to be culturally appropriate, and we have to understand how do we present information in a way that people are able to engage. And the ACA set aside resources to create and implement and evaluate measures both to improve health literacy and also to tailor the information that we provide to people and the services that we provide to people, so that it's really comprehensible, to a broad range of us. And I really admire, the ACA is a very long, when it came out, people complained that it was this really long, dense bill. The ACA was actually shorter than Sarah Palin's memoirs, as I recall, if you counted the words, but it was long and dense. And it's probably because there's just a lot of junk DNA that's required to say, I'm trying to explain to people how they can access services, when they have some pretty granular challenges. And some of the information that's provided is critically important. You have diabetes. We're going to give you some information about how you can be health literate about how your diet may need to change. That's critical life-saving information. It has to be provided to people in a way that is culturally competent. That says, if you come from a particular community and here's the way that many people eat in that community, let's reevaluate. Maybe some of the meats that you're eating are really here's some good substitutes for those that are going to help you with your diabetes or whatever the issue is. So I think that public health authorities and the people that designed the ACA really tried to take this very seriously. I'll pass it back over to you.
Yeah, and we actually see some of that work that they put in through this plan, and these are pretty much the main goals. There are 7 of them. We will be breaking them down on the following slides, and we can definitely share a little more about that. Mm-hmm. So part of the first 2 goals of the National Action Plan to Improve the Health Literacy is the first one, to develop and disseminate health and safety information that is accurate, accessible, and actionable. And then the second one would be to promote changes in the healthcare delivery system to improve the information, communication, informed decision-making, and access to health services. And in my opinion, I think these are pretty much the 2 main ones that focus on addressing health literacy and trying to see what outcomes we want to come out of this. And some of the things we would want you all to consider is that communication with your patients, especially during clinic visits, is an important step to improving health literacy, because a lot of the times it's hard to identify people that don't have appropriate health literacy. A lot of the times they fall through the cracks. And, a sad reality is a lot of people that have low health literacy may not even show up to your clinic in the first place. So just having that mentality of, if I get a chance to address it, I should, because we don't know where the patients could be at the time where they're coming into your clinic. And some of the things that we can do during those initial visits, it's to increase their patient motivation and success in health literacy learning. And it should be an interprofessional effort. Physicians and clinicians do not have a lot of time based on our current model of the health system, right? You may be seeing patients for 5 to 10, 15 minutes, depending on your health infrastructure that you have there. So it is very vital that we involve nurses, we involve front office clerical staff to definitely provide this information, because at the end of the day, that's something that is going to be our first line of defense against low health literacy. And that goes into the third bullet point, which you want to connect the patients with resources that will allow them to have access to different health insurance information. Harold, would you like to add anything to that?
Yeah, in some ways, this may be my favorite slide in the whole presentation. I think it's so important to understand both what's central about what physicians and nurse practitioners do for patients, but also the limits of that. As Isaac pointed out, healthcare providers don't have a ton of time. Healthcare providers do have a ton of credibility. And one of the things that can be done during a clinical visit is to say, one of the most important, as we're trying to manage your diabetes, here's the medicines that I'm giving you. Here's what they do. And there's some things that you're going to do as a patient that can be very valuable to improve your health. And I'm going to learn with some humility from other professionals, nurses, social workers, and others, how to talk with people in different communities. You can imagine the nerdy University of Chicago professor. If I'm sort of having a patient who's from little village in Chicago, I'm not going to know how to talk to that person about their diabetes, even if I know a ton about the science of diabetes. I have to have some humility and talk to folks that have cultural competence. But then I can also vouch for them with the patient, because the patient's kind of looking for me as the nerdy, expert. I can say, our diabetes educator is going to be talking to you and going to be giving you some very important information. And she is a pro at what she does. And I really want you to especially listen to some of the changes that you're going to want to make in your everyday diet. And she's going to help you explain. She's going to help you understand, how do I do that? How do I want to cook my food differently? Here's some great things I can do. And there, your credibility helps her do her job, and her skills helps you do your job. And that's that interprofessional aspect of that. So I'll pass it back over to you.
Yeah, and that is definitely a great point. And another thing that's very, very important within your clinics, within your healthcare setting, whatever that may be, is visibility. A lot of the times we already see that visibility for other diseases. For example, if you run a family medicine clinic, chances are very likely that you have posters lying around your clinic rooms or the waiting room that have information on the disease, right? Like, this is what diabetes is, this is what hypertension is, these are some steps you can take. And we can actually take that approach with health literacy. So when I was in the classroom, one of the biggest things that we were told to do is, put things up for students, right? Because a lot of the times they may have some free time to do things, and we as people, we tend to look around, especially when we're waiting. So if you're able to add resources out there for health literacy, for health insurance, you can even connect patients when they're not necessarily engaged directly with the healthcare system. And something that we have provided for you is a small QR code here in the lower right corner of the screen. If you do notice that, if you scan it, it will send you to the healthcare.gov website. It's going to give you the opportunity to look for community partners that actually help people enroll during the enrollment period. They'll help patients and individuals find health insurance. And if there are technological barriers, like we mentioned earlier, these individuals that you find on this page will actually be able to assist them in this process. And you can actually, it's very neat. You can filter through, cities, zip code, and it will give you a variety of resources. So that's something we highly recommend having out. If you do have a clinic, if you do have a waiting room, maybe posting up this QR code, even though, again, that does have some technological barriers, but even then you may have somebody in your clinic, clerical staff, maybe go out and print a list of individuals that come from this website. So that's a great way to make those connections for patients and make sure that, again, it's an interprofessional effort, not only within the healthcare system, but also in other branches as well. The next goal that we're going to talk about is goal 3. And it's the main thing that it says is to incorporate accurate and standard-based health and developmentally appropriate health and science information and curricula into childcare and education through the university level. And I think for me, this is one of my favorite slides. So I'm a former educator, and I feel like once you're in the classroom, that never leaves you. So I think it's very important to try to address this issue before it becomes an issue. And one of the ways we do that is through education at the university level, but also at the grade school level, because not every American goes to college, and even those that do may not even graduate. So we need to address that before. And so some things we want you to take into consideration is, if you're part of a medical school, if you're part your healthcare system has a free clinic, or you have partnerships within the community, that can definitely be a good vehicle for improving health literacy, and especially for medical students if you do work for them. And if you don't, this can be a great opportunity for your clinicians there as well. This will definitely expose you to a population that needs that help. And another thing that we would recommend is that centers of higher education and health sector organizations can partner with local grade schools to proactively address low health literacy, as I was talking earlier.
One of the things that I would just add to that is we want to normalize the idea that it's great to ask questions. It's totally okay to not know the answers to everything. I'm a 7th grader, and I'm realizing that I'm I'm LGBTQ. There's a lot of questions that I have about how to be as healthy as I can be, and it's great that you're asking questions. And I have a health condition and I don't know a lot about it. We want to completely normalize at earliest ages possible. It's great to understand, to think about what is it that I need to know, what is it that I don't know, and who do I ask? And there's nothing embarrassing about having low literacy, no low health literacy. It's just something you have to address the same way that you gotta read the directions on a lot of stuff, and your healthcare is sometimes one of those things.
Definitely. So this next slide talks about literacy goals 4 and 5, and 4 just says that they want to support and expand local efforts to provide adult education, English language instruction, and culturally and linguistically appropriate health information services for the communities, and to also build partnerships, develop guidance, and change policies. And last slide we were talking about addressing this issue before it becomes an issue. Try to be proactive about it, but nonetheless, there's always going to be people that fall within the cracks that we might not be able to address in the first round. And just like Harold was talking about earlier, having low health literacy shouldn't be something to be ashamed about. It's something that it is what it is, and we can do our best to keep on addressing that. So finding organizations that can provide the adult education. A lot of people with low health literacy may have English as a second language, or they may not even speak English at all. So having those resources can be definitely helpful. So some of the things we do want you to consider, especially since we're talking about culture in this particular slide, is that low-income patients and others may face burdens of care that may divert their focus from health literacy. There may be a million things in their mind, and health might be the 3rd or 4th thing that they think about, if they even think about it at all. Also, limited English proficiency patients may not have access to interpreters or translators to adequately navigate the healthcare system. So it's very important that if you do work at a clinic and you do serve a large population that have a second language other than English, to find individuals that can fill that gap, or local organizations that may provide interpreting service. Also, the concept of cultural humility when approaching these health literacy education. We don't ever want to look down on anybody for their lack of knowledge in this area, because it's a very complicated system, and the most educated of individuals also have trouble with these as well. And also to identify local and national nonprofit organizations that are well established in your community to help. A lot of the times, minority communities, people with low socioeconomic status, are very reserved, and they really listen to very specific groups, right? They already have gained their trust through the work that they do. So it's important to find and identify those.
Well, I'll just add one thing on the cultural humility front. Every group of people that we serve in the healthcare system, there are tremendous strengths that we are not aware of if we're not members of those communities. to help people with their health literacy. So, if I have, say I'm providing healthcare to Hmong immigrants in rural Minnesota, and I have a patient who has some dietary restrictions, there are, within the Hmong community, there's a whole set of dietary practices that are healthy, that if I have the humility to ask, I can find out, here's some foods that are common, in your community, that seem to be really both appealing and healthy. And here's some things you probably want to stay away from. I mean, the least healthy diet basically in America is what we might call the conventional Western diet. I'm just going to have a hamburger with lots of mustard and ketchup thrown on it and some French fries. There's, you compare that to what, say, immigrants from Central America are often eating on a daily basis. Older people are eating a much more healthy diet than their children are. And so part of the cultural humility is to say, how can we draw on the strengths there and say, you're actually quite blessed that there's some really great foods that you probably already know how to prepare that would be great for you, to help us manage this health condition, or just whatever the issue is. So I'll pass it back over to you, Az.
And then now we're going to just focus on the last two goals of the national plan. And those are to increase basic research and the development, implementation, and evaluation of practices and interventions to improve health literacy, and to increase the dissemination and use of evidence-based health literacy practice and interventions. So this is actually a very big part that really affects people in academia, right? When we look at the clinic base, and we look at healthcare in general, it is very based on evidence-based practice, right? What is the best practice that has been researched, that has been shown to work? And there has actually been some infrastructure that has been set up for this, right? There are different organizations that support literacy research, whether that be specifically in health or in other aspects. One thing that we probably will notice is that literacy can be tied at all levels, right? If you have low reading literacy, that chances are you'll have low health literacy, low technological literacy, and vice versa. So some of those organizations that you can definitely look into that provide more information is the U.S. Department of Education's, especially for the Division of Adult Education and Literacy. And then also the Agency for Healthcare Research and Quality and the National Institutes of Health, the Eunice Kennedy Shriver National Institute of Child Health and Human Development. I'm not sure if, Harold, you know of any additional resources or anything that you may suggest and when trying to devise or design research protocols to address this issue.
I think you've identified the key areas. I think that whatever health system you're in, one of the most important things you want to do is to try to identify what are best practices for helping our patients with literacy challenges to navigate the health system. And are we actually doing those best practices? And how can I, as a provider, be better trained to execute the practices that are within my control? And how can I work with others within our healthcare system to raise our game as a healthcare system to make sure that we are doing this? I think one of the biggest cop-outs in healthcare is to push the burden onto the patients, and actually pushing the burden onto individual healthcare providers, and without systems in place to help people. And then sometimes you hear people say, I can't be more worried about your health than you are. And that's often those kinds of formulations that you'll hear from jaded providers sometimes are a way of pushing the burden onto patients for things that we need to partner with them and help them do. And health literacy is one of the barriers that patients face that we just need to approach in an evidence-based, transparent, and humane way, and find ways to help our patients improve their health. And I'll stop there.
Yeah, and I think when you're talking about burden of care, something that we should strive to do is really empower patients, right? You want them to be capable of making these decisions for themselves, because there's not a greater feeling of not knowing how to navigate a system and then learning how to do it. It's a very empowering feeling. It makes you want to be more involved in your health. And then that can definitely improve some of their outcomes, because they may adhere to medication regimens better. I think one thing that is very important with education in general, not necessarily just with health literacy, is that feeling of being able to do something for yourself. And that's probably the best thing that we can do, especially when we're talking about health literacy with these patients.
That's such a great point to end on, I think, that giving our patients a sense of control and self-efficacy. First of all, our patients will be more likely to adhere to recommended treatments. But secondly, it's just so important for people's sense of well-being and confidence as a person. It's just a really, it's just a really difficult place to be when you're saying, I have a health problem, I'm bewildered, and I just don't understand what I'm supposed to be doing. And I think that just so adds to people's anxiety and stress and sense of personal inadequacy when they have that sense of bewilderment, which so often we can help people to address. And it is, we just know in every domain of life, when you say, hey, I feel empowered, I can learn about this, here's some things I can do to improve my health. That's just such a better place to be when you're like, I'm going to the doctor, he's going to tell me to do a bunch of stuff, I don't really understand what he's telling me to do, I'll take the medicine that he or she has asked me to take, but then otherwise I'm basically kind of passive. That's just not a humane place to leave people if we can help them really get a sense of ownership and control over their bodies and their minds and their health.
I think that's a very important point. And unfortunately, this, we're going to be closing up this session. This is not enough time to have a conversation about health literacy, right? What we wanted to do is just get that conversation started. Whether you're in a clinic, whether you're a medical student or a resident, it's important to keep these things in the back of your head and sometimes even in the forefront. And we encourage you to definitely keep on looking into these, look at these resources, find what's available to you. And just like as complicated that the healthcare system is, this topic of health literacy is very complex within itself. So we just really want to encourage you to continue those discussions in and out of the clinic to be able to address this. And we also like to take the, Harold, I'm not sure if you have any additional closing thoughts.
No, I think you've nailed it. So I think you can close this out.
Yeah, of course. We do want to thank the American Medical Association for giving us this platform to be able to start this conversation at a national level. We are very thankful for that. I really want to thank you, Harold, for your participation in this and all of the expertise that you have brought onto this presentation. It's been a very pleasure to work with you and all the staff from the AMA that makes this possible. We are very grateful for that opportunity.